Hello friends, today we are going to learn about the abnormal uterine bleeding. First we see the definition. Any abnormal uterine bleeding in term of abnormal amount, duration and frequency. अगर menstrual bleeding के amount, उसके duration और frequency में abnormalities आती है तो हम उसको abnormal uterine bleeding बोलेंगे. So, before going to the abnormal bleeding, we have to understand the normal values. Mean frequency of the menstrual cycle is 28 plus or minus 7 days. So, 21 to 35 days is a normal frequency. Average menstrual blood loss is 35 ml. So, the 10 to 80 ml is a normal value. Average number of the menses is 4 days or 2 to 7 days is a normal duration. We see the causes. Causes is divided into two parts, structural causes and non-structural causes. We can see it by the mnemonics palm and coin. P stands for polyps, A stands for adenomyosis, L stands for leiomyomas, M for malignancy. In non-structural causes, in coin, C stands for coagulopathy, O for ovulatory, E for endometrial, I for iatrogenic and N for not otherwise classified. Other causes of the abnormal uterine bleeding are the contraception, pregnancy or the PCOS disease. Patterns of the abnormal uterine bleeding: menorrhagia, hypomenorrhea, oligomenorrhea and polymenorrhea, metrorrhagia. These are the patterns of the abnormal uterine bleeding. Also the DUB, dysfunctional uterine bleeding, it is also considered in the AUB. It is different from AUB but it is considered in AUB. First we see the menorrhagia, also known as hypomenorrhea. Definition: menorrhagia is defined as a cyclic bleeding at the normal interval. The bleeding is either excessive in amount 80 ml or duration greater than 7 days or both. The term menotoxis is often used to denote the prolonged bleeding. In short, the amount of the menses is greater than 80 ml. We cannot measure the amount of the bleeding, so we have to consider the pads used per day as an amount, and duration is greater than 7 days or the both condition is applied. Next is hypomenorrhea. Definition: when the menstrual bleeding is usually scanty and lasts for less than 2 days, it is called a hypomenorrhea. In short, the menses is scanty in amount less than 35 ml. In menorrhagia, we see that the menses is excessive and greater than 80 ml. And in hypomenorrhea, the menses is scanty and the amount is less than 35 ml. And the duration is less than 2 days. This is called a hypomenorrhea. Polymenorrhea. Definition: polymenorrhea is defined as a cyclic bleeding where the cycle is reduced to the limit of the less than 21 days and remain constant at the frequency. In short, the frequency is less than 21 days. In cyclic bleeding, the menses comes at 21 days and in second cycle the menses come at 21 days. Excessive bleeding and prolonged bleeding, also known as the epimenorrhea. Next is oligomenorrhea. Definition: menstrual bleeding occurring more than 35 days apart and which remain constant at the frequency is called oligomenorrhea. In polymenorrhea, we see that the menses is less than 21 days. And in oligomenorrhea, the menses frequency of the menses is greater than 35 days. अगर मेंसेस आता है वो 35 फर्स्ट मेंस्ट्रुअल साइकिल जो 35 डेज़ है और दूसरी मेंस्ट्रुअल साइकिल भी 35 डेज़ के बाद ही आती है और वो कांस्टेंट है हर महीने और हर साइकिल के बाद, तो उसको हम ओलिगोमेनोरिया में कंसिडर करेंगे. नेक्स्ट इज मेट्रोरेजिया. Definition: Metrorrhagia is defined as the irregular acyclic bleeding from the uterus. Amount of the bleeding is variable. In short, in metrorrhagia, irregular bleeding होती है due to some clinical condition or some pathological condition, and this clinical condition are the contact bleeding and intermenstrual bleeding. Contact bleeding means the cervical cancer or the polyps in uterus. Due to this condition the bleedings occur. Or in intermenstrual bleeding, the bleeding occurs during between the two menstrual cycle, is called the intermenstrual bleeding. Next is dysfunctional uterine bleeding, DUB. It is different from the AUB because in AUB the bleeding occurs due to some pathological condition, and in DUB, dysfunctional uterine bleeding, the bleedings occur without any cause or pathological condition. Definition: DUB is defined as a state of abnormal uterine bleeding without any clinical detectable organic, systemic and the iatrogenic cause. In short, abnormal uterine bleeding without any pathological or the clinical condition. Now we see the all patterns of the abnormal uterine bleeding by the short trick. First is menorrhagia and second is hypomenorrhea. In menorrhagia, the amount is greater than 80 ml, and in hypomenorrhea, the amount is less than 35 ml. In duration, in menorrhagia, the duration is greater than 7 days. In hypomenorrhea, the duration is less than 2 days. Third is oligomenorrhea and fourth is polymenorrhea. In oligomenorrhea, the frequency is less than 21 days, and polymenorrhea, the frequency is greater than 35 days. Fifth is metrorrhagia and sixth is DUB. In metrorrhagia, the irregular bleeding occurs due to the clinical condition or the pathological condition, and in DUB, the abnormal uterine bleeding without any pathological or the clinical condition. Thanks for watching. Please share and subscribe.